Hello, everyone. Welcome to the third episode of Mommy Index, interviews with my favorite businesses. And today's a very special episode because we are actually interviewing a nonprofit. So we are welcoming Cynthia Brashears and Morgan White with Birth Equity Advocacy Project. Welcome, ladies.
Hi.
Hi.
Ladies, if you don't mind just introducing yourselves and just kind of telling us a little bit about BEEP.
Yeah. Cynthia, do you want to go first or?
Sure. So my name is Cynthia Brashears. I'm the co-director of BEEP, which is the Birth Equity Advocacy Project. We are a 501c4 organization that focuses on confronting the disparities of maternal care for women of color. Preferably, Black women are 3 to 4 times more likely to die during the process of childbirth, according to the Centers of Disease Control. And we really think that that's an issue that we can formidably address by promoting our organization and just getting the word out about some of these issues.
Yeah. And I'm Morgan White, as Jane said, and I am in California. I'm the California side of BEEP. We are in California, Colorado, and Georgia. And we are in these spaces, one, because we're physically there, but also just because of the difference in the spectrum of outcomes and influences that have a really big factor in how women of color get quality care and get access to as many resources as possible. And so just piggybacking off of what Cynthia said, we are here to lobby and advocate and spend unlimited amounts of time. We can work on this without any limitation, which is why we're very happy to be in this kind of space that we're in for this issue. Because we can, again, spend all of our time on advocating for these kinds of women and birthing people. And it was important for us in coming up with this and creating this and building this platform to be cognizant of the amount of people that have been working on this. So we're really happy to share as many organizations with you as possible that are working to help educate and promote awareness just like us, that have been doing this work for years, right? This work has been going on for a very long time. And it's because this issue has been going on since forever. And it's because of just the history of our country, right? And so when you think about the African Americans' relationship with medicine and healthcare, it's largely not something that is, historically been a great relationship. And so as what we've learned in being new to the organizational space of this is that there's a lot of people that have been working on this, but something that hasn't been done to a large extent, and is still a part of the problem, is that you don't see a lot of advocacy in the lobbying space on this. Like, you don't see a lot of people of color in the lobbying space in general, and you really don't see it for maternal care, and specifically for women of color, in maternal care. And that's because it's something that, just to be quite frank, people don't care about. And that is largely due to, a statistic that Cynthia spoke to, which is, the likelihood of women of color to, have these maternal mortality outcomes. And it is only and completely unequivocally due to racism. And it is completely correlated to that. And, there are other things that compound that, right? Such as poverty, lack of education, lack of financial literacy. There's so many other things that we already know exist that are compounding factors. And racism in our healthcare is another layer in that plays, just obviously, as we've seen, a detrimental role in how women of color, create life, right? And so we see from the very beginning of what we've learned from the very beginning of when they want to start to have a family to up until the moment they, have given birth, this huge gap in what is right and wrong. It's so alarming when we hear stories of from women that we've spoken to, and the resounding, consistent part of the narrative is that no one listens to them. They go into these spaces for the safe space that they're supposed to be, and expect that they'll be trusted when it comes to their body. We've been in our bodies for how many years now? Like, we know ourselves individually, right? And so we're always going to know ourselves better than someone who's never seen us before. And when you just think about it that simply, it seems kind of unbelievable, right? Or like, it seems maybe far reaching that it's just that kind of a simple step that completely breaks down the quality that they get. But it's really that simple. It takes just that. It takes the complete dismissal of pain that we've heard, the complete dismissal of what their needs are, the complete dismissal of what they prefer, right? And all of that is packed in this nice package. And what it ends up looking like is women not making it out with their baby, or the baby and the mother both don't make it, right? And it's just, of course, it's really sad, and it's hard to listen to that, as it should be for anyone. But because we know that that's one of the most consistent things we hear, we can immediately see where we need to plug in, right? Where we need to activate advocacy, right? And how to activate that. And, from Cynthia and I's both combined experience, we've worked in our communities, and we've worked in these capacities that give us the insight and the perspective to say, you know what, we get where you're coming from, and you are valued, right? Which is, I think, very missed in all of this, is that Black women are largely devalued. So it starts with that. It starts with listening, making sure that they feel valued in any respect to this process, and birthing people. And then taking that step of saying, okay, well, what could have been done better? And those are the internal conversations we have, right? Why does that look like that in this space? I mean, the issues in California are far different from Colorado, far different from the ones in Georgia, and so on, right? And so taking the time to really look at just those lenses and those spaces is, it's already a lot. It's a lot of things that are not really being done the right way. And so, in learning that, we are constantly learning how to be better advocates to these organizations and other spaces. As a 501c4, we get to be that ranter and raver, supporting what the grassroots and the 501c3s are doing, right? On the grassroots level, I mean. And so we don't do the grassroots work, right? That is not we are good at that, right? But that's not what we are here to do, because we know that work is being done by really great people that have been doing it, right? So we're not here to dilute the space and take away from the work that's been done. We're really here to sit at the table with them and say, okay, how do we make your voice louder? And like, how do we work with, who else can we work with, right? To help make theirs louder as well, right? And to really be a partner in that. But I hope that gives a little bit of an idea. I know I went on for a little bit, about just, what we're trying to do, right? And why it's important that we try to do this. Yeah.
Definitely. Thank you so much for sharing all of that. I'm sure a lot of our listeners are, in a population that does not experience these disparities, or do not know of these stories, do not have this awareness. And I think it's just so important that you are shining a really powerful bright light on this horrifying topic, but turning a negative into a positive by doing the work you are doing. And I think I'd like to ask a little bit more about not only the advocating piece, but the lobbying piece, because I know that's kind of the direct work that your organization is doing besides the research. So I don't know, if that's something you could tell our listeners a little bit more about.
Sure. In terms of lobbying, what we're looking to do is to go into those spaces where there are proposed legislative positions and have an opportunity to provide a voice again for this groundswell of people that we're advocating for, and kind of bring that lens into that policy making process. We want to support legislative efforts, and we also want to drive the awareness of the issue. So generally, being able to lobby in that space is the most important work, as you said, that we're doing. Evaluating, proposed legislation in all 3 states, Colorado, California, and Georgia, so that basically we're able to bring those voices to the table and evaluate the bills that are out there and support, the policies that we feel are really going to represent our experience going forward, and just kind of building on those policies so that we can build a better path for Black women when they decide to parent.
Yeah. And, another side of this, it is mainly lobbying, but we really wanted to divide that, so half our time is lobbying. The other half is really working with our community stakeholders. It is also reaching out into the community to work on events, collaborate with them to, kind of do these awareness campaigns. We know the federal government, on the federal side, there's the MomNibus, which is amazingly comprehensive. We know that other places are trying to adopt the same policy framework. And that is really great, and I think that says a lot to the space that we're in, the time that we're in, right? And speaking to like why this issue is so urgent, and like it's great to see the urgency, right? On the policy side, but we all know policy moves incredibly slow, right? And so the other part of that, and the other leg of that we really want to, highlight in our work is the awareness, right? Because activating our communities of color that have no idea how to be their own advocates, they don't understand, and working with our providers as well in those spaces to understand the difference between clinical intuition and implicit bias, right? Because those are very different things. And if you're inherently learning a certain way and then you incorporate your own biases into that unconsciously, how are you not going to provide inequality in your care, right? Like that's going to happen just naturally without you probably even knowing it, right? And so it's really helping them to even see what we know we've heard, and then bringing all of that back to the table and saying, these are things that you should know, in that space, and feel empowered to know that other people have been in the space too, and this is actually what we know is right? And it's never overstepping the boundaries of the providers, but it is really empowering them, hopefully it will, right, to understand the difference in all of those things, right? And when you are getting unequal treatment, and when you should say something, right? When you shouldn't just say, oh, you're the doctor / I obviously don't know better, right? And that's what we hear a lot. We hear that a lot. And we also, in that space, in that same light, are really focused on also sharing resilient stories, because we know that resilience is vital to empowerment and being a better advocate for yourself, right? It is knowing the right way. It is hearing women have amazing experiences, women of color who have had amazing experiences, and can share that and say, it's possible, right? It's not impossible to get this. This is possible, right? This is just how it looks for me, right? And that may be possible for you. Because at the end of the day, when we go into the hospital, like Cynthia spoke to earlier, it doesn't matter what our degree is. It doesn't matter how smart we are. It doesn't matter if we went to Harvard. It doesn't even matter if we're wearing a Harvard sweatshirt. They don't think we're real alumni, probably, right? Or just all of those things have no factor. When we go in, we are all the same to a lot of these spaces, right? A lot of these providers. And with that goes those generalizations, those stereotypes, those completely ignorantly lined beliefs that, women of color and people of color have less sensitive nerve endings so that they don't feel pain quite the same, right? Things that are actually taught in medical school. And it's just like, where do you start, right? Where do we start now? Because we're at the bottom of this and it's already being completely told the wrong way. And we unfortunately know that's a fact, right? And we've heard studies and read studies of white medical students who have spoken to, using that line of judgment in how they treat their patients. And in pregnancy, justifying that line of judgment by overstepping what the women want. And so you see this overuse of C-sections on women of color. You see what we've heard is them getting their uterus removed. And it is just like, it's infuriating because, you just don't understand it. It's so scary to think that you have no safe space, right? Like, there is no safe space. And if you are lucky enough and if you have enough money maybe and maybe enough resources, you can find a Black OBGYN, but that's only very relatively new concept. Like, the abundance of that is not historically there, right? And so it is just all of those factors. And, it's not even we're not here to really tell people either, like, you're terrible for not knowing this, or like, you are, shame on you for not thinking about this. It's more of, hey, now we're sharing it with you, and like, please just be aware of it, right? Like, hopefully our providers see more of these moments and take a second thought and, just take a second approach to how they treat people humanely, right? Under the guise of public care, right? And the Hippocratic Oath, right? So it's, it's really that journey. It's kind of frustrating when we are calling even our donor, even to get donations, right? We hear a lot of people say, I just don't really care about this, and I have other things that are priority. And that right there is saying that Black women have no value to you. They are not valuable, right? Like, there's a real level of devaluation in that statement, right? But they will also say, I'm not racist, and that's a very real part of this conversation, right? It is finding that part on the spectrum of ignorance and just figuring out, like, you don't have to say you're these things, that's fine, right? We know what it is, right? But please just recognize that this is a reality for some women, regardless of what we have our own personal self see or believe is possible. It happens, right? I actually was not fully sure. I mean, not fully sure, I shouldn't say that. I actually was kind of largely unaware until a couple of years ago when I was introduced to this subject issue. And I didn't look at it through this lens. I never had a reason to think about that. I had been in a car accident, and so I grew up in a family of providers. And so I always had that advocate. I always had someone to say, oh, you're not doing that to her. She's a young woman, or you're going to not do that there. And so I always knew that was a privilege, right? When I learned of this happening in the space of maternal care, it just became a whole new level of understanding. Because to imagine a woman who's already vulnerable, who's already maybe a first-time mom or a single mom or an unwed mom, or all of these things that are already very difficult, and not even just being a woman, right? Like, that's very difficult in this society anyway. It broke my heart that they were just so alone. They felt so alone in this, and they're not, right? And that's also a part of the work we do. It's the lobbying, and then like that's really equally as important to the lobbying to us, because we really don't want them to feel alone.
Well, in the case of that comes to mind off the top of my head, the story that Serena Williams told recently about her experience in giving birth. I can't imagine that Serena Williams doesn't know her own body if something's wrong. Um, and I'm sure that the best, most available resources were offered to her, based on, her status in our society. But for her to communicate to the public that she felt that way um, after giving birth and that her life was in danger and she felt ignored, even with all of the support that she does have, was really kind of touching to me. And it kind of drives home some of the disparities that we are experiencing in the Black community.
Yeah.
That's just, yeah, that's just so much. I guess I quite don't know even how to respond in this moment to all of that. That's just like, yeah, unimaginable, I think. And so I'm really grateful for you to take the time to really share all of this. And I know maybe half the frustration is having to explain it, but
we love explaining it, by the way.
So I feel like we've covered a lot of ground, and I think we've covered the most important areas. What kind of just steering in a different direction here? I feel like you might have inadvertently answered this, but what is your favorite part about being part of this organization and sharing it with new moms or new moms to be?
Yeah. Honestly, it is it's actually the very last thing I say. Like, we don't want them to feel alone. It is not feeling that way and like hearing them not feel that way. Like, that's probably the best part, right? Like, when they see like the people we even share, even when we shared, the mommy index, like a lot of our followers wrote to us and were like, thank you, this is awesome, right? And it's so great to feel that unity. And so like, we really love, I mean, as hard as the work is, and we're very passionate. So sorry if we getting very passionate. But it is really the beauty in that unity, right? Like, I absolutely this fires me up, right? Because at the end of the day, we are making a better space for women, all women, right? Like, when we help the most disenfranchised people, we are helping everyone, right? And that is something that I think it's just, it helps keep me going, right? And it makes me very excited when I get up in the morning, because I know I'm helping like these women, right? And more importantly, the space, right? And for me personally, one of my favorite parts is so far has been meeting organizations that I probably thought I would never get the privilege or honor of speaking to, and them just wanting to talk to us. Like, that is awesome, right? Like, it is absolutely incredible, because that means that like I think we're doing the right thing. Like, we're doing something right, and like that feels good. But I hope that answered that. Cynthia, what is your favorite part? I never thought about this, so I was a little like, oh wow.
Well, I like the idea of just creating a sister circle of mothers and birthing people that are experiencing some of the same things and supporting each other. Because it's not always just up to the individual family or the provider or the organization, just kind of holding hands and creating that safe space community for Black families that can lean on. And that's the most important thing as well. And bringing in those resources so that they can access those resources and be able to get the support they need ongoing.
Yeah.
Beautiful. So for our viewers watching right now, for those who are women of color who could really benefit from this advocacy and this awareness and this information, what's the best way they can utilize this information or get in contact with your organization?
Yeah, they can go to our website. It's birthequityap.org. We have an email as well. It's info@birthequityap.org. And I guess from my perspective, we love to learn from the women that we're representing. So if you feel comfortable in sharing a story with us, we just want to reassure you that it is a safe space, and whatever direction and permission you give us to use with the story, we will take that completely. And we just first and foremost want to be the best listeners and advocates to the women that we we advocate for. So please don't feel like you need to hold back, or I guess in any way that we wouldn't believe you. We believe every single thing we hear because we know it's possible. But yeah, you can reach us on Instagram and our social media as well.
Yeah, we have a really great Facebook page, and we welcome your comments and views on that. Also, again, Instagram and Twitter, we're out there. And we'd love to, again, hear your stories and engage with you. No comment. We wouldn't reject any comment. We just want to hear from the community, and we want to know how we can help.
Yeah.
And just kind of piggybacking on that, when you were talking a lot about self-advocating and kind of learning how to speak up and what to say, is there any type of class or literature or coaching that's kind of out there within or with outside of your organization that can kind of give women that?
We have not, Cynthia, I don't think we've thought about that. I mean, we think about that in the space of like our awareness campaigns, right? But in terms of tangible directness, right? Like if anyone is listening, anyone that sees this, really to anyone in general, if you are wanting to talk about the issue or just learn how to be a better advocate in the issue to the space for yourself, we're available for that. That's a part of our job, right? And so just please feel free to contact us. We have a phone number for our organization. I honestly do not know it by heart, but when I get it, I will put it in the comments. But you can call us, right? And we will always make time, right, to help empower anyone that really needs it, right? And we have an advisory board of Black OBGYNs and attorneys and all these different people from these different backgrounds to help us speak better to this, right? So I hope that kind of maybe answers that.
Well, we're hoping to build a platform of issue advocacy and education. So that is something that we plan to roll out, and having more contact with the community. So that's an objective that we have going forward as well.
And honestly, we're not here to like tell people necessarily. I guess I want to clarify this part. We're not here to tell people how to speak to this issue, right? Because at one end of this spectrum, there is authenticity in everyone's individual narrative that's relative to them, and we respect that, right? And so, how we feel about the issue, more than happy to share that, right? More than happy to tell people how we feel, how we speak to it. We speak to it as a human rights violation. But it is really something that we're also privy to, that being respectful to the space, it is like not maybe creating that narrative too much, right? It's also doing more of the listening. But to people that want to learn about it, yes, please call us an email. But yeah, I also want to make sure our audience members know, like, if you have your own experiences, we're not going to tell you how to talk about that, right? Yeah, that's important to us. So.
And is there any message you'd like to say to our non-mothers of color, or anything that besides, I feel like this is a whole conversation that, we could keep talking for hours and go down the rabbit hole, but the simplest way off the top of your mind right now, besides, educating themselves and really informing themselves on privilege and anti-racism, is there anything else that's just like message you want to send out there to that audience?
Yeah. I would say, you know, I guess listen to your friends of color, right? I would just say, like, if you feel comfortable, ask them, like, what was your experience, right? Like, how was that for you? I think that the more is personal to us in this time that we live in, it is more impactful. And so I would just say, really try to put your ear to the ground in terms of the people of color in your life, right? And understanding what their experiences have been. And that in of itself is that awareness, right? And that is the first step, right? It's really just kind of taking that perspective on and being like, oh wow, that's kind of crazy, right? And we still get blown away. It's like, as women of color that are very well versed, we still hear things and are like, you got to be kidding me, And so it's still something that everyone, it's a learning curve for everyone, right? The other thing is, put money into the space. There's no money into this space, right? And that's largely contributed to why it is still relatively unknown, right? We need more money in this space. We need to empower and help financially support our 501c3s and our 501c4s that are on the ground, right, doing this work, so they can keep doing it, and we can do the work louder together, right? That would be my 2 cents.
Well, and I would just like to say, if you see a instance of disparity and you feel and you see it in your heart, don't be silent. Speak to that. There may be a level of authority that you have that we may not have, unfortunately. So that's an opportunity for you to speak up and to help in a tangible way.
But thank you so much, Jane. Like, literally, this is why we're doing this. We want birth equity for all, right? We just prioritize women of color because we understand the huge gap, right? But we really appreciate you giving us this space and this platform, and caring to give us the space and platform. Like, we definitely don't take that for granted. So thank you.
Yeah, you're so welcome. Thank you, ladies, so much for being on Mommy Index and raising awareness about a very important topic. So if you out there listening and want to learn more, contribute, or create awareness to the Birth Equity Advocacy Project, please reach out. I will post in the comments how to get in contact with them. Thank you, Morgan, and thank you, Cynthia. And we will talk to you soon.